Welcome to this screencast on social work theory. The material in this presentation is based on the first 3 chapters of Malcolm Payne's Modern Social Work Theory textbook. Let's start with a definition. Theory is defined as a generalized set of ideas that describe and explain our knowledge of the world around us in an organized way. So the important words that jump out here are that theories are comprised by more than one idea. It's a set of concepts or ideas that comprise a larger theory. These ideas are descriptive, they're explanatory, and they are organized in a way that helps us to understand what is happening in the situation that is around us or the world around us. So let's look at the relationship between social work and theory. And sometimes in this course, students are asking, why do we need a theory course? Why do we have to learn about all of these different types of theories? And some students may feel challenged by the amount of content and the amount of material that is presented in this course. But I want to make the point that what we do as social workers is connected with concepts about what it is that we're doing. So we need to have some guiding ideas in order to conduct an assessment, in order to choose our interventions, and in order to understand the outcomes that we're working towards. So the points on this slide are that social work theory helps us to practice, take action, as well as to understand what it is that we're doing. A requirement of a theory that's used in social work is that it must interact with the profession of social work. So think about what we do as social workers. We work with clients. Clients can be children, adolescents, adults, older adults. Our clients can sometimes be a group or a community. So any theory that we're going to use must interact and be applicable to the needs of our client populations. So it must be grounded in a helping relationship, in a way of understanding human behavior, and a way of describing and explaining what is going to be most helpful with our client population. So basically, the theory must be useful, it must be relevant, it must be effective in what we do. And you're going to need to decide as a practitioner which theories are most useful to you and the clients that you work with. And social work theories offer a large framework. Think of a framework as a container, and the container contains ideas and concepts. And from that container, you get to choose which ideas are going to be helpful. And you get to choose which ideas you want to leave behind and not use, or leave for perhaps using the next time around. And finally, theories help us to be accountable professionals. They give us a language and a vocabulary that we can use with our clients, with our colleagues, with our supervisors, and it gives us a way of framing our social work practice. So while theory means that you're thinking about something, and it's a cognitive process, and practice involves doing something or taking action, they're both interconnected. Before we take action, we need to think about what's needed. We need to think about what is going to be most helpful. So theory and practice are really two sides of the same coin. We need both in order to be accountable professionals that are effective at what we do, at helping our clients. So this slide presents some points that I pulled out of the Payne book. The first one in the bubble is social work is an activity. Again, social work means doing, taking action. So theories must explain the real world, right? It must connect us with what we're doing, with how we're practicing, and with whom we are practicing. The second bubble, social workers build both practice theory. We build both through our experience operating in the real world. And sometimes you'll hear the term practice wisdom, and this is what this point refers to. We're active builders, or actively constructing our knowledge of what our clients need, how we practice social work, what are effective interventions, what actions we need to take, what resources we need to draw from. So we are building practice knowledge, and often that integrates theoretical concepts. And both theory and practice wisdom are both important for us in our work. Third bubble, theory helps us understand and test ideas of the world around us. So, an example of how theory helps us in this case is, say you have a client who comes to meet with you, and in your assessment of the client, you learn that the client is experiencing intrusive thoughts, is experiencing nightmares, is experiencing startle reactions. You may recognize these 3 symptoms as related to post-traumatic stress disorder, or PTSD. So, having that knowledge leads us to hypothesize that your client has experienced a traumatic event. So you can then begin to ask questions and continue your assessment to determine if your client has had an experience that's connected to the symptoms that your client is presenting with. So that's an example of how theory helps us to understand and test ideas. And finally, just as the world evolves and changes, so do theories. Theories are not static, fixed ideas. They're only useful as much as they can be applied to the work that we do. And just the way we learn, grow, and develop, and our clients learn, grow, and develop, so do theories. Theories are able to be adapted. Now, we need to adapt them and adapt the ideas and apply the ideas to our practice. But that's the way that theories are debated and theories are applied and researched. So even though in this course we're looking at theories that have evolved over the past century, we're still looking at elements that are very useful for us today and looking at how the understanding and thinking about these ideas have also changed. So to be clear, Payne talks about 4 main uses of theory. And there may be more than 4, but these are the top 4 uses that Payne identifies. Some of this we've talked a little bit about. But number 1, theories help us to understand and critique ideas. Critical thinking and critique of the theories is an important part of this course. We can't just accept what theories tell us. We have to judge for ourselves using our critical thinking, analyzing and evaluating the effective and usefulness of these theories. Theories reveal and make clear things that might not be obvious. They do this by directing our attention to specific types of information that we can then build upon and seek to understand or describe. Number two, theories offer explanations, help us gain greater understanding. So as social workers, we deal with a lot of complexity. We deal with a lot of gray areas that our clients find themselves in situations where they need help. And often we are making assessments that contain large amounts of information. And theories can help us focus and prioritize so that we can then take action that is most relevant. Number three, theories offer a practice framework. Remember, I had used the metaphor of a container, and that we can reach into that container and draw upon useful ideas and concepts. And that's a way that theories help us to organize ideas. And theories not only help us practice, but theory guides our research as well. So they offer many different types of guidance, how to break down complicated situations, how to take action, what to focus on, how to understand, explain, and describe. Number four, theory helps us to be accountable professionals. They give us a language, a vocabulary, they provide a way of thinking about the practice of social work. And they can help us justify and explain what we're doing and why. And this last point is really important. Some of you are already familiar with the emphasis on productivity, with the vast amounts of paperwork and utilization reviews that are required in order for reimbursement. And theories can help us. And indeed, theories often are the difference between our ability to be reimbursed for our work and what is not reimbursable. Payne identifies two types of theories. One is a formal theory that is written down, debated, researched in the profession, as well as in academia. And the image I chose are three white men, buttoned down, looking very formal. And in fact, the theories that we're going to be discussing in this course and that you're going to be reading about are formal theories. So they're theories that largely have developed through the efforts of white men, and furthermore, through the efforts of middle-class, highly educated white men. So we need to be able to use our critical thinking skills. Are these theories applicable to our populations? Are these theories applicable to the types of needs that we encounter in our practice? And in contrast with formal theories, another type is informal theory, which consists of ideas that are derived from society or from practice. So often our cultural knowledge, knowledge from pop culture, knowledge from our experience working with client populations, from working in specific communities with very specific needs. We build our knowledge. We actively construct informal theories about what is happening, what to do, what our clients need, and what's the best course of action to take. And the image for an informal theory, I chose three diverse women. And I chose this because, one, social work is largely a female-dominated profession. I think about 85% of social workers are identified as female. And just to mention here, I'm not just looking at female, male as a binary. I'm just using this as a generalization. There are certainly LGBTQ and non-gender binary folks in our profession who have played a very important role in the development of theory. So informal theory is another way of saying practice wisdom. And I want to emphasize this because I want to make sure that we give informal theory and practice wisdom validation as well, in addition to the more formal theories that we're going to be looking at. Payne also identifies 4 types or 4 categories of practice theory. The first one is a perspective. A perspective is a kind of large approach that is a way of thinking about the world that's based on values. It's based on a particular philosophy and principles. So perspectives help you to apply, specific, coherent ideas to whatever it is situation you're encountering with your client population. So they are sets of ideas that are useful and value-based. As an example of this, the strengths perspective. You may have heard of strengths. It's a way of approaching our clients that respects their experience, that identifies that all clients have some resources and some strengths that we can use and mobilize in our work with our clients. It directs our attention to what is working in our client's life, not just the problems and the risks and the deficits, but the ways that our clients are surviving and meeting the challenges. They may need help, and that's why they're sitting with you, social work practitioner, but it's important to have the perspective that clients are able to draw upon some strengths. So that's a large perspective. The next category are frameworks. So a framework is a little bit more narrow, and it is based on a body of knowledge that is also organized in a more systematic way than a perspective. So a framework helps you to focus and select useful knowledge in a more specific way. So an example of a framework is an ecological framework. An ecological framework directs our attention to the social context. There are many, many variables in the social context. For example, race, gender, socioeconomic status, disability status, immigration status, as well as age, ethnicity. So I could go on and on about an ecological framework and the variables, but because there are these large variables, not all of them are going to apply. But in your assessment with your client, you're going to choose what is most important. So maybe gender is an important variable. Maybe ethnicity is an important variable. So you can choose particular variables that are organized within that framework. The third category is models. And a model is a pattern of activity. It's based on a clear sequence of actions or action steps. It is structured to help you organize what to do and how to do it. So a model is a guide. It provides an example of what to do, a series of steps. Do this first, then step 2, then step 3, so on and so on. And there are practice models, cognitive behavioral models that are very specified and detailed about the interventions that you use. And finally, the fourth type is an explanatory theory. An explanatory theory accounts for why something happens, what causes it. It identifies particular circumstances, and it helps you to understand what works, how to do it, why to do it. So it explains something. It's a way of making sense about something. So you can think of these 4 practice theories where the perspectives are the broadest view. Then frameworks is a little bit more contained. Models are more narrow. And then explanatory theories are much more specific. So in that way, this is how they're organized. So some additional points to consider on this slide. Practice theory means that practitioners do not need to rethink social work practice every time they see a client. In other words, we don't have to reinvent the wheel. When we see clients who have similar issues or similar problems or needs, theory can guide us into understanding and directing us on what actions are needed. Theory suggests a set of ideas about social work and events in the social environment that describe and explain in an organized way. So it helps us to identify themes. It helps us to identify phenomena that we encounter again and again. Symptomatology, for example. You may have heard of the DSM-5 and the way that symptoms are grouped into specific diagnoses. That's a way of describing large amounts of information. So you have 3 clients that present with anxiety, where they have excessive worrying. They're not able to sleep without waking up and thinking about their problems. They're expecting the worst to happen, and they may feel that perhaps other people are expecting them to be perfect or judging them. So these are all signs of anxiety. So you encounter 3 clients and you're able to make connections about the symptoms that they're discussing and presenting with, which lead you to hypothesize that all 3 clients are experiencing an anxiety disorder. The third bullet point is that theories provide general guidance on how to think, how to react, how to act, what to do, how to do it, why you're doing it, and so forth. And this is a very important point. Practitioners, meaning us, were able to adapt these theoretical concepts or sets of ideas to different situations with a variety of clients and client populations. So theories in and of themselves are only helpful when we can use them and apply them. So we need to learn them and be familiar with them and be comfortable with theories enough so that we can use them in ways that are helpful for us. So think of theories as tools that are part of our practice skills. So, for example, you may have heard about attachment theory, and we are going to be discussing attachment theory in more depth at a later point. But now let's just use the example that understanding attachment theory helped to inform us about what we're seeing in the relationship between a child and a parent. So we're observing their interactions, we're listening to what a parent is saying and the way that the child is responding to the parent, and we can determine, is the child securely attached, insecurely attached? Is the child showing an anxious ambivalent attachment? So the attachment theory directs our attention to look for specific types of behavior that will then help us determine how this parent and child can be helped. How does their relationship need to be strengthened? What steps can we take in our intervention to help that parent and child communicate better, feel more comfortable with each other, and work together as a family? So all theories are based on values. That's a really important point. And when we start analyzing and evaluating theories, we will be able to recognize the assumptions that underlie the theories and the principles that these theories are based on. It's a very important part of critical thinking. So for us, we need to look at social work theories and evaluate their effectiveness according to 5 values that are shared within the social work profession. Number 1, does the theory direct our attention to an alliance between the worker and the client? So does the theory account for the establishment of a relationship, of the development of a therapeutic alliance that will be helpful to the client, and to informing the client about informed consent? Number 2, the shared value on agreement about the aim of the social work treatment or social work practice. Does the theory allow for clearly specified and positive outcomes? In other words, does the theory allow for change? Number 3, does the theory allow for action sequences, or a model, or action steps? Does it give you some direction on what to do and how to do it? Number 4, does it allow for critical practice? Critical practice means that you can think critically about how the theory is useful and what is not useful, meaning that you can then choose. In other words, how can you adapt the theory to make it more effective for your client? Does it allow for a critique of the assumptions that underlie the theory? In other words, does it exclude parts of our population or make assumptions that may reflect negatively on our client population? And then number 5, human rights. Does the theory allow for cultural respect, acknowledgement of human rights, of equality and equity? So does the theory respect our client population? So these are 5 very important value principles of social work that we draw upon, and we need to think about the theories in terms of these 5 values that can help us determine, is this a good social work theory? Is this helpful? Do I feel comfortable with it? Does it help me in my practice with my client population? So I mentioned critical thinking in the previous slide. This is really important. Both critical thinking and reflection are social work skills. They're part of our toolbox that help us to be more effective social workers. So critical thinking is defined as the ability to conceptualize, apply, analyze, synthesize, and or evaluate information. So the theories we're going to be looking at is just a bunch of information. It's a set of ideas, concepts. We need to deconstruct them, take them apart in order to determine if they're useful, in order to think critically about how to use them. So using your analysis skills, going into depth, looking at not just what is clearly specified, but what are the assumptions. Is the theory presented in a reasonable way? Is it logical, systematic? Can we make sense of this theory? Does it lead us to greater understanding? And then the third bullet, questioning existing assumptions and comparing them against evidence. So critical thinking about, does the theory help us understand what it is we're observing? Does it help us to test out our ideas? So this is very brief points about critical thinking. I really just want to make the point that we need to think deeply in this course, that we need to use a variety of perspectives and reactions and ideas, and not jump to conclusions, but rather really analyze and evaluate what it is that we're learning and how it's going to be useful. And to some degree, this process is going to be unique to each one of us. We may feel drawn to some theories and not so much to other theories. Some of our client populations may lead us to use some theories over others. That's all part of critical thinking, making decisions about what to do, how to do it with our clients, about having self-awareness and being able to separate our own assumptions from our client's experience. Critical thinking is very helpful with that. And then reflection thinking, being reflective, is another skill that we use. And reflection is a cognitive process. It can include some emotions, but we also need to be objective about what is it that's going on inside of us. What perspectives do we need to think about that can help us gain greater understanding, that can lead us to have greater insight into what's happening in this situation with our clients. Reflecting on something means that we take the time to sit quietly. What's going on? Allow for our ideas to emerge. It also allows us to challenge assumptions, our own, as well as identifying and recognizing what may be embedded in the situation or what may not be so obvious in a particular situation. Reflection allows us to clarify and hone in on our ideas. It helps us to generate feedback, and it helps us to learn from our experiences. And what I want to point out about reflection is that it's closely connected to listening, and deep and active listening is also a skill that's really important for us to develop as social workers, because reflection is listening to our own thoughts. And when we listen actively to what our clients are telling us, we're able to reflect back to them what it is that they're saying and how we understand what they're trying to communicate to us. So critical thinking and reflection are really important processes that will help us not only in this course. I would actually say that these are crucial to this course, that we use critical thinking and reflection during all of our class sessions, but also in all of your other classes and in all of the ways that you will be practicing. So this is our final slide. I just put together some takeaway points. social work theories connected with the real world. It is meant to be used, it's meant to be applied, it's meant to be adapted. It is not abstract or irrelevant. These are ideas that we work with and that contribute to the way we construct our practice wisdom. That what we do and how we do it in our practice is important. And it is integrated and interconnected with theoretical concepts and ideas. It's not something that exists outside of you. It's not something that exists outside of the profession, but rather it's an integral part. Theory helps us to be consistent and well organized. It's systematic, provides guidance, and it helps us to organize our thoughts. Theory provides a framework. It's a container. We can pull out specific concepts that are useful. We can leave behind others that aren't so useful. It helps us to deepen our skills in conducting assessments with our clients, in reaching clinical judgments. That's really important, and you'll be talking about that a lot more in practice classes. But clinical judgments are based on how we think and in connection with what we're observing about our clients through their verbal and nonverbal communication and how we're making sense of what they're telling us. So theory provides a framework for assessment, clinical judgment, for intervention, and I would also include evaluation, because practice evaluation is an important part of reflecting on our practice and our work. As social workers, we value lifelong learning, so we're in a constant learning mode. Just because you have worked with 100 clients presenting with similar issues doesn't mean you know everything about that issue. There's always more to learn. There always is more to uncover. And finally, theory helps us explain what we're doing with our clients. It helps us explain our work to our clients, with supervisors, and with colleagues. So again, it provides a language and a vocabulary, and it helps to train our minds so that we're more competent and insightful social workers. This is our last slide. I hope that you have taken away some of the material that is covered in week 1, and we will be talking about this in our Zoom class. For now, I'm going to say goodbye.